Hello and welcome to Dr. Chajlani's video presentation series. In this, we'll be talking on facial rejuvenation as a confidence booster. Aging is a process which we all know happens to us and we cannot reverse it. But there are ways by which we can have a feel-good situation and we can slow down the process of aging, at least look-wise, by surgical and non-surgical techniques. And there are also adjunct techniques to facial rejuvenation surgery for rest of the body also. And we can have rhinoplasty, facial scars, baldness, ear, chin, body contouring, etc. Now these can be done as an office procedure like Botox and facial fillers, or they can be done as an office surgery procedure in the operation theatre. We can have various blemishes removed on the face. One can go for having a dimple on the chin. One can have lip reduction, or one can have a lip size increased. And then facial blemishes or scars can be corrected by a process known as dermabrasion. So these patients have undergone a process called as dermabrasion. This lady also had her mole removed for beauty purpose from her cheek onto her upper lip. This lady had a mid-face aging and wanted a better facial appearance and brightness in the eyes. So dermabrasion and facial fillers and fat grafting was done, which has a permanent effect. This lady had acne scarring, which was corrected by dermabrasion. This lady wanted an office procedure of dermabrasion, so a microneedling technique was done. And then we come on to facial fillers or fat graft as a filler. This lady had a tear trough or a orbital trough, which was corrected by fat graft, and these effects are almost permanent. This patient had a deep nasolabial groove, which was corrected by a facial filler, which can have an effect for 1 year. And this patient underwent a fat grafting, which is almost a permanent effect. This lady had a birth defect and fat grafting was done for her and for this lady also, who had a severe acne depression of the cheeks. This lady had a severe facial deformity for which multiple sittings of fat grafting have been done. This lady also underwent fat grafting for a better appearance of the upper lip, and she also had a rhinoplasty. And as I said, rhinoplasty is an adjunct procedure. This lady had facial nerve paralysis, which was corrected by Botox, and here the facial nerve paralysis was corrected by facial slings. This patient has had Botox and fillers done for the wrinkles and for volume metric correction of the face. This lady had a chemical peel done for the pigmentation on her cheeks. Aging shows very early on the eyes, and this lady underwent upper lid correction or blepharoplasty, and this lady underwent upper and lower lid correction or blepharoplasty. As I said, there are various adjunct procedures like rhinoplasty, hair transplant, chin correction, breast surgery, etc., or liposuction. Here, these patients have gone removal of the cysts on the face. Scar corrections can be done by scar revision or by dermabrasion. Earlobe correction can be done when they are elongated, or ear setback can be done when the ears are prominent. Here, scar correction has been done and a mole removal has been done in 2 separate patients. This patient underwent rhinoplasty for a hump and a long nose which has been shortened, and everything is done from inside. This lady had a broad nose which has been corrected, and you can see her in front and her side views. This lady also underwent a rhinoplasty for a deviated nose and a broad nose, and a hump reduction was also done for her. This lady had a hump on both sides, and a hump correction has been done through rhinoplasty. This lady had a broad nasal tip which has been corrected, And this lady had a depressed nose which has been corrected by putting a cartilage graft. Gynecomastia or enlargement of male breast is known in young as well as adult patients, and it can be corrected. Or sagging of the breast or heavy breasts can be reduced by mammoplasty, or sagging breast can be corrected by putting in implants to give them a lift. Or liposuction can be done for areas which are fat or localized fat, or tummy tuck can be given to have a better contour of the body. Hair transplants can be done to take care of the baldness, and it may need more than one sitting. Thank you for attending this session on facial rejuvenation and adjunct procedures. Thank you for your time and your patience. Thank you and welcome once again. Thank you.